All righty, everyone. Good morning and welcome to our Cracking the Code webinar series. My name is Michael Jones, and you are here for our MedExPROs 6-point criteria for insurance reimbursement for MET services. Now, folks, the reason we're talking so much about insurance reimbursement is because we're seeing the growing need for medical exercise training across the board here in North America, if not around the world. With that, we've now been training medical exercise specialists for 31 years. And back in 1996, we saw the first medical exercise specialist receive insurance reimbursement, and it's continued to grow from there. We know now that with the aging of North America, particularly the increase in chronic diseases, there will be a need after physical therapy, chiropractic, and other medical services are done for an ongoing exercise program to maintain the client's level of function. Think about this. That 78-year-old client you have who has Parkinson's disease, but also had a hip replacement. After they've finished with physical therapy, they're able to climb the stairs, they're able to get out of the house, they're able to go to the grocery store, go to church, maybe go to the movies or dinner. But if they don't keep up their exercise, they gradually deteriorate to the point now they have to re-enter the healthcare system. Maybe they need to get more physical therapy. Maybe they eventually get to the point they fall and injure themselves and they now have to go into a nursing home. So you can see medical exercise training can be that conduit that maintains their level of independent function. So you now need to start dealing with insurance carriers because insurance carriers realize when they go back to the nursing home or they're now bedbound for a period of time and they have to receive medical services, those now cost more. So a better or more advantageous point of view may be to say, hey, we're going to now provide medical exercise services to keep this client fully functional. So that's why we're talking about this 6-point criteria. So please, if you would remember, before you even start this process of looking at getting reimbursement from the insurance carrier, you need to understand this 6-point criteria is before we start this process of getting insurance reimbursement, you need to meet these 6. And let me give you a little bit more specifics. 5 of those 6 are vitally important. The 6th one actually is the icing on the cake. So if you don't mind, let's go through these. Now, all of this information I'm going to give you is in a new manual we have called Cracking the Code. It's Cracking the Code, the ultimate guide to insurance reimbursement for medical exercise specialists. We published this book about a month or so ago. It is a digital download. It is 398 pages. It goes through MET billing, procedures, guidelines, the step-by-step process, billing system forms, CPT codes, ICD-10 codes, sample MET forms. It's everything you need if you want to engage and start billing insurance carriers. So let's get started with the meat of the information. And one of the most important things here, first, is your scope of practice. And we start talking about billing insurance carriers, you can only bill what is within your scope of practice. Now, as a medical exercise or a fitness professional, at this point, you're not licensed by states or jurisdictions, but you do have a certification. The licensure is for physical therapists, chiropractors, physicians, nurses. So for you, you have a scope of practice based on your certification. So here at the Medical Exercise Training Institute, we've had a 31-year scope of practice for our MESs, and it's very clear. You can provide medical exercise training assessments, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, which is going to become vitally more important over the next 2 decades as we see an aging population. Also, aquatic training and stabilization training. Now, notice it doesn't say anything about ultrasound, massage. Now, if you're a massage therapist and you're licensed to do that, great, you can bill for it. But physical therapy modalities, electric stim, ultrasound, hot packs, cold packs, if you try to bill for those folks, that's outside of your purview, outside of your scope of practice, and that is illegal. And it can get you in a lot of trouble from the standpoint of insurance fraud, but also violating the state's Practice Act, the Medical Practice Act. So be careful about that. And with that said, let's talk about this criteria. This is a 6-point criteria. It's the standard when dealing with insurance carriers regarding insurance reimbursement for medical exercise training services. So number 1, you must have a written referral from an MD, a DO, or a DPM, Doctor of Podiatric Medicine, or it can come from an NP, nurse practitioner, physician's assistant, but both of those individuals are supervised by an MD or DO. So you must have a written referral. Here's what a written referral looks like. We give these out in our MedExPRO or MES network, and this is what a referral looks like. Notice this is going to be signed by the physician or the nurse practitioner or the physician's assistant. But again, remember, they are under the auspices of an MD or a DO. The client's name goes in, their condition or diagnosis, and please make sure that the form, when you get it back, has a diagnostic code or ICD-10 code that goes along with the diagnosis. And I'd recommend, if you're going to communicate with the doctors and get this information, the diagnosis, and get this form completed, ask them to give you a primary and a secondary diagnosis. Both of those, they should also give you an ICD-10 diagnostic code. You'll notice here it says post-rehab functional conditioning services requested. What happens here is the physician just simply checks off or circles what he or she wants. They also put in the duration, the frequency, any remarks, sign it, date it. That's your written referral. This now indicates medical necessity. The highest medical authority, the physician, has said this client needs this exercise program to manage their medical condition. Now, let me make sure you're clear. You're not trying to take the place of the physical therapist. You're not providing any therapy. You're not providing any treatment. And this is a client and not a patient. So number one, get a written referral. Number two, make sure the client has received the maximum benefit from physical therapy, occupational therapy, or chiropractic care, or what other services they were seeking from the licensed medical provider. What we're saying here simply, folks, is client goes out and they twist their ankle on a Tuesday afternoon. They've got a session with you on Friday. They now come to you with the idea you're going to do some therapy on their ankle. Please, folks, medical exercise training is not designed to circumvent the medical system or get around going to the physician, the therapist, the chiropractor. So please, for these clients that are coming to you, they've received the maximum benefit from physical therapy, occupational therapy, chiropractic services. They've gotten the maximum benefit, and now they're transitioning over to you. So we're not trying to go around the therapist, but we're part of that continuum from therapy on to bridging that gap. So now this client can get a good fitness program that will continue to improve their level of function. We're going to talk about function in just a second. Number three, the client has undergone a surgery. They've had a major trauma or they have a chronic condition. So this isn't a client that just sprained their ankle, maybe pulled a hamstring, has a little bit of back pain. This is a client that has a serious medical condition. They've undergone some surgery. Maybe they've had a trauma or they have a chronic condition. This isn't the guys I said before that just sprained their ankle on Tuesday. Now they're coming to see you on Friday so they can get around going to the therapist or going to the physician. No, this is a person who's utilized the healthcare system. And with that, they have a major condition. They've had a trauma, an injury. They've undergone a surgery or they have a chronic condition. Undergone surgery, say an ACL reconstruction. Trauma, a fractured hip. Chronic condition, MS or Parkinson's, something along those lines. Number four, the client has residual functional deficits that are left over after physical therapy, chiropractic, all the other medical services. They still have residual functional deficits. Now, let me date myself here. Folks, I graduated from physical therapy school, Howard University, in 1985. So this is my 40th year as a physical therapist. When I was a young therapist, and I had hair back then. When I was a young therapist, after, say, an ACL reconstruction, that patient would come in and we could work with them and probably get 24 to 26 weeks of physical therapy paid for by the insurance carrier. Nowadays, for that ACL reconstruction client, you might get 8 to 10 visits and that's it. So the healthcare system has changed, which means now that patient that I saw in physical therapy back in the 1980s and 90s, I got that client probably to 90% of their full or optimal level of function. Nowadays, the physical therapist is only able to get them to maybe 25, 30, 40% at max. And now you step in and you now continue on. So they're out of the acute phase. Swelling pain, for the most part, has been handled. Now your job is to utilize exercise to now deal with the residual functional deficits, such as limitation in strength, flexibility, endurance, power, stability, balance, coordination, things of that nature. So your job now is to develop an exercise program that you assess the client, determine what their functional limitations are, which are a result of residual functional deficits, and you develop an exercise program targeting those deficits. So the client comes to you with deficits, you identify those, manage those with exercise, the client gets better. That's criteria number 4. Criteria number 5, their insurance coverage is not through Medicare or Medicaid. Now, Medicare and Medicaid are government supervised medical services. They're supervised by the Department of Health and Human Services. Now, with that, they have very strict guidelines. They will not reimburse for services that are not provided by a licensed medical provider. So if you're not licensed as a physical therapist, a chiropractor, a physician, a nurse, occupational therapist, Medicaid and Medicare are not going to reimburse for your services. Now, some of you will say, oh, wait a minute, Dr. Mike, we got reimbursed. There will always be things that fall through the cracks. But I guarantee you, you're not going to have an ongoing reimbursement. Eventually, they will audit the claims that you sent in and find out, or they'll send you a letter asking you for your state license number. So 99% of the time, the coverage that the client comes in with cannot be Medicaid or Medicare. There will be that 1% you might get paid, but also going along with that, you're going to have a hell of a paper trail, lots of documentation you have to do. And in many instances, the reimbursement is so low, it's going to cause you a problem. All right. And then next, number 6, you've established short-term and long-term goals and a plan of exercise, or what we in healthcare, it would be a plan of care. For you guys, it's a plan of exercise, or a POE. So let me explain how that works. So we've gone through these 6 criteria. You've gotten a written referral from the physician. The client has received the maximum benefit from physical therapy, occupational therapy, and chiropractic care. They now need your services to get them farther down the road. They have undergone a surgery. They may have a major trauma, or they have a chronic condition. They do have residual deficits that are left over after physical therapy or chiropractic or occupational therapy in strength, flexibility, balance, endurance, stability, whatever the case is. They're not covered by Medicaid or Medicare. So you now have seen this client for just a preliminary or just a simple screening. You've determined that based on what you see with this client, you've established some basic short-term and long-term goals and an idea of the exercise program. Those are the 6 things you need before you even begin to think of the idea of insurance reimbursement. And you say, well, Dr. Mike, that's pretty strict. Yes, it is. It is pretty strict. But what the insurance carriers are trying to do is avoid paying for things that don't fall in the realm of medical necessity. Please write that down. Medical necessity. Every point on this in this criteria looks at medical necessity. The doctor, the physician, the MD, or the doctor of podiatric medicine, or the DO says this client needs this exercise to manage a medical condition, medical necessity. They receive the maximum benefit from physical therapy, occupational therapy, or chiropractic care, and they still have a need. Again, medical necessity. They've undergone a surgery, they have had a major trauma, they have a chronic condition, and they have residual functional deficits that are left over. Again, medical necessity. Their coverage is not Medicaid or Medicare, and you've established short-term and long-term goals and a plan of exercise that, again, indicates the client's medical necessity or the need for this exercise program. So please, if you would, make a note, medical necessity is really the basis of all of this. So if you don't mind, when we start looking at this idea of billing the insurance carriers, you need to have a guide. That's why we put together this Cracking the Code guide. The Cracking the Code gives you everything you need to go back and address these 6 criteria, these 6 components. It has the forms you need. It has the written referral forms that you need. It explains the maximum benefit. It talks about the different conditions that you can work with. It talks about how to measure and assess these functional deficits, and then to use those to say, yes, the client needs these services. It also talks about the insurance carriers you can deal with, which are private third-party carriers, workman's comp carriers, auto accident carriers, but we also take you step by step through the billing process. And then lastly, we also talk about long-term and short-term goals. So if you're looking at billing the insurance carrier, always ask yourself, does the client meet these 6 criteria? If they don't, then you need to kind of step back and say, well, what do we need here? Or you may have to say, this client doesn't qualify for insurance reimbursement. We're going to now have to go the cash and carry route where they're paying you for the services. Please understand, just because a client has health insurance doesn't mean, as a physical therapist, I can bill them for a service. If the service is not indicated, if they don't have a medical condition, as a therapist, I can't bill, which the same thing holds true for you as a medical exercise professional. There must be medical necessity there for the insurance carrier to even entertain the idea of reimbursing, and that's what this criteria looks at. Now, we're trying to do these in a more timely manner on Friday mornings because I know most of you, Friday around noon Eastern, or if you're out on in the Central Time Zone, Mountain or Pacific Time Zone, you're trying to get your day done so you can get out and you can enjoy yourself after a long, hard week. So these Cracking the Code webinars are free. We meet every Friday at noon Eastern time. They are recorded. So if you go over to crackingthecode.net, you'll be able to see the recording for this. And with that, please also understand that you can purchase the Cracking the Code manual at crackingthecode.net. It gives you everything you need, and it talks about these various components that we've discussed in greater detail. Now, for some of you out there, you are building a strong practice. You've developed referral relationships with medical providers, or you're trying to. And one of the biggest questions that you get when you start dealing with the medical provider is, do you take insurance? That's what they're asking you. For many of you, that shuts the whole conversation down. Or you say, well, Dr. Mike, I'm not even sure where to start. We're offering a special coaching program, our Reimbursement Jumpstart Basic Program. It's one 90-minute to 2-hour coaching session. You're going to get our AMES manual. Now, many of you have seen this before. You'll get a digital copy of our AMES manual. This is our Advanced Medical Exercise Specialist manual. It's the manual that actually is the operating manual or the procedure manual for everything you'll do in medical exercise training. You'll get that Cracking the Code manual as a digital manual. You'll get access to our Jumpstart program, and we're going to give you 10 of the forms you need to build a medical exercise training practice, such as a referral form, a release of information form, an assessment summary form, a session log. So now you can start communicating with the medical community. We're going to put your name, your contact information, if you have a logo, on those. And we're going to give you some contact templates so that now you can communicate in a written form, sending letters to doctors, therapists, and chiropractors, and you get access to our MES network for 3 months. Now, normally that's about $527. We're doing it for $300. And if you go over to crackingthecode.net right now, until Monday, it's only $199. So with that said, I'm going to stop my screen share here, and I'm going to see if I can answer any questions that anyone might have. If anyone has a question, please pose it. I'll be glad to answer it for you. And even if you don't have questions, I'm going to pose one question to you guys. So let me wait for a second. See if anybody has a question. There's something here in the chat. Let me see what we got in the chat. All righty. Okay. Let me pose a question to you. As a medical exercise professional, you're working with clients that have medical conditions. With these clients that have medical conditions, are you communicating on an ongoing basis with their doctor, therapist, and chiropractor? Are you sending progress reports? If nothing else, when they sent you the referral, did you respond in a written or even a verbal fashion where you called the physician or you sent a letter or to the therapist that said thank you? And did you provide a progress report, a periodic progress report that says, here's how the client is doing with the exercise? If the physician or therapist or chiropractor referred the client to you, they essentially are saying, my patient needs this. It is a medical necessity that they utilize this exercise to get back to where they were before. So you're part of that medical management plan. If you're not communicating with the doctor, therapist, or chiropractor, in my opinion, you're not providing medical exercise services. You're doing personal training with a client with a medical condition. With that being said, if you're not communicating with the doctor, therapist, or chiropractor, you're probably missing out on referrals, and you definitely will miss out on the ability to eventually bill an insurance carrier because you have to have number one in the criteria, which was that written referral. You're going to get that by communicating directly with the doctor, therapist, or chiropractor. So with that said, We know medical exercise training will grow exponentially over the next 2 decades. The reason? The baby boomers, of which I'm at the tail end of the baby boomers. Yes, I'm at the point now where probably one day I'll need a total knee replacement in the next 2 or 3 years from an old college injury, old ACL tear. Or maybe I need a hip replacement. I got an arthritic hip from a parachute jump when I was young and dumb in the Army. Had a couple pins put in there. I'm also hypertensive. So with that, think about this. How long will I be your client as a medical exercise specialist? Probably the rest of my life, won't I? If I have the knee replacement, the hip replacement, and I need to manage my hypertension, it makes sense that the physician, my physician, would continually send me to you. But after the surgeries, I see the physical therapist for a period of time. I get to a point of functional capabilities, and then I'm referred to you after physical therapy for ongoing exercise. You see? And if you're communicating with the physician, therapist, or chiropractor, you have an ongoing referral base. And if you start dealing with the insurance carriers, it makes it even easier for you. Now, yes, you may have to wait for your insurance reimbursement a few weeks, a couple of months. Okay. But remember, the client still pays a copay. And the client also, depending upon how you structure it, the client can pay half of the service fee, and you bill the other half. It's up to you. So please, if you would, start to look at this idea. How do I expand my medical exercise or medical fitness practice? And that requires I do develop relationships with the medical community. It does require I put systems in place, and it does require that I now start looking at the bigger picture. So with that said, thank you for joining us. Have a great remainder of your Friday and have a great weekend. And if you have any questions for me, email me at drmike@postrehab.com. Go over to crackingthecode.net. You can see the recording of this. It'll probably post sometime on Saturday, tomorrow, as well as you can purchase our Cracking the Code manual, and you can also take advantage of our Reimbursement Jumpstart program. So all the best. Have a great remainder of the day, and thank you for joining us.